What if I told you that the most dangerous time for your heart isn't when you're exercising, or even when you're stressed, it's while you're asleep? Every year, millions of adults over 60 suffer heart attacks and strokes during the night or in the early morning hours, often without any warning. The frightening part? Many of these events are linked to 3 bedtime habits that most people think are completely harmless. Today, you'll discover what a heart doctor says you should never do before bed, why these habits silently overload your heart, and a simple nighttime routine that may help protect your heart while you sleep. Stay until the end because the third mistake surprises almost everyone, and correcting it takes less than 30 seconds. When you fall asleep, your body enters repair mode. Your heart rate slows. Blood pressure normally drops. Your blood vessels relax. Hormones begin repairing damaged tissues. But here's something many people don't realize: during the night, your body's emergency defenses are reduced. Medical researchers have found that many cardiovascular events occur during the late night and early morning hours when changes in blood pressure, heart rhythm, oxygen levels, and blood clotting naturally occur. For adults over 60, these changes become even more significant because aging arteries are often less flexible, circulation slows, and existing conditions such as high blood pressure or diabetes place additional stress on the cardiovascular system. That's why your bedtime routine matters far more than most people realize. Before we go further, comment below your age and where you're watching from. I read every comment, and it helps others see they're not alone on this journey. Let's start with the biggest mistake. Mistake number 1, eating a heavy dinner right before bed. Imagine asking your heart to run a marathon just before it's supposed to rest. That's essentially what happens after a large late-night meal. When you eat a heavy dinner, especially one high in saturated fat, fried foods, refined carbohydrates, or oversized portions, your digestive system immediately demands more blood flow. Instead of relaxing for overnight recovery, your heart has to pump harder to support digestion. Your metabolism speeds up, body temperature rises, and nighttime blood pressure may remain elevated. Scientific evidence, a 2020 American Heart Association scientific statement published in Circulation found that regularly eating late at night is associated with poorer blood sugar control, higher blood pressure, and an increased risk of cardiovascular disease. Heart doctor's recommendation. Try finishing your main meal at least 2 to 3 hours before bedtime. For many people, that means eating dinner around 6 o'clock or 7 p.m. Mistake number 2, ignoring loud snoring and sleep apnea. Many people joke about snoring, but cardiologists often don't, because snoring can be a warning sign of obstructive sleep apnea. Sleep apnea occurs when the airway repeatedly collapses during sleep. Each pause in breathing lowers oxygen levels, causing stress hormones to surge and forcing the heart to work much harder throughout the night. Scientific evidence, a 2021 American Heart Association scientific statement reported that obstructive sleep apnea is strongly linked to high blood pressure, atrial fibrillation, heart failure, stroke, and coronary artery disease because repeated drops in oxygen place significant stress on the heart. Mistake number 3, becoming dehydrated before bed. Many older adults intentionally stop drinking water in the evening because they don't want to wake up during the night to use the bathroom. But when you're dehydrated, blood volume decreases, circulation becomes less efficient, and your heart has to work harder to pump blood throughout your body. Scientific evidence, the National Academies of Sciences, Engineering, and Medicine notes that maintaining adequate hydration is essential for supporting normal blood circulation and cardiovascular function, while older adults are at greater risk of dehydration because the natural sensation of thirst declines with age. Tonight, ask yourself 3 simple questions. Did I finish dinner early enough? Could my snoring be a sign of sleep apnea? Am I going to bed properly hydrated? Small changes repeated every night can add up over months and years. If you found this video helpful, share it with someone over 60 who cares about protecting their heart. Comment below, which bedtime habit are you changing tonight, eating earlier, getting checked for sleep apnea, or improving hydration?